We live in South Dakota where everyone is legally required to have health care. People pay around $4,500 yearly for basic health care.
In South Dakota, the health care cost is about $235 per month, but in Alaska, the amount is almost double. Alaska has been the highest state in health insurance cost.
However, in Oregon, people only pay around $206 per monthly for monthly health care, making Oregon the lowest health care paying state in 2015.
Should people pay based on their income?
Or should all people pay the same?
Or should they not pay at all?
I think that there should be some level of health care for everybody. Now, we have some level of health care provided for those over 65 and children, and we have supplements to people that can't afford it, which is what Obamacare did.
22 million Americans covered now that weren't covered.
I feel like the population should have to pay for insurance.
74% of ER visitors are 18 and under, and 11% of them are uninsured.
Because you may never use it, and you may use a lot of it. It's just it's a chance you'll take if you don't.
I think almost every first world country, we've reached a point where we can provide at least a basic level of health care.
The U.S. spends the most on health care, so could it really hurt to take the price down?
Where, let's say, people realized that nobody would ever go after them, then nobody would pay, so then nobody would pay at all. So then the government would be paying, or people wouldn't be paying, so the system would collapse.
That would be a big problem is that people would be like, well, I am just gonna, kick back and not work at all, and then I could just get free health care. We would hope that would.
We all do contribute to healthcare through taxes or through our work or through private insurance, which is what most of us contribute to. And I think that people contributing to the health system based on what their ability to pay is probably the closest we're going to get in the U.S. to getting something where we're all taking kind of an equal share.
And it's not fair for the person that makes more to have to pay more, but they have the income to do that. A little bit. There are people that fall in the cracks with that where they don't make a minimal amount to only pay a minimal amount for insurance, but then
that's, if everyone were to pay the same thing, then that's really an unfair advantage to people that are really struggling in other areas of their life but have a healthcare crisis, especially with how expensive healthcare is.
In 2012, families paid $15,745 for health care, while singles only paid $5,615.
It's hard for the people that work at, say they work at Hy-Vee or McDonald's, to pay the same amount for somebody that is an executive, at some big business like U.S. Bank or something.
And it really is, I feel, a utility for people. That's like saying, everyone should have to pay the same thing to use roads that way. Well, right now you can go see a general practitioner, and you could go there for a flu or an illness, and if you don't have insurance, then you have to pay. And if you don't pay that, it affects your credit score.
But even still, there's a significant number of people that don't have insurance.
And it's kind of like you never know if something will happen. It's kind of like that safety net.
Then we could make laws saying, hey, look, basic care is taken care of, and if you can't afford something, you can't afford it. So everyone pays by contribution, in terms of taxation. There's probably a quarter of all our staff is designed just for billing and our coding purposes in order for us to make the maximum amount of money. That's almost every practice in the U.S.
In some countries, people do not have to pay for their health care. Is that something that we should do too?
So I think there is good things about it because then they don't have to worry about, I don't have insurance, I can't go. But then there's bad points to it where you can't get in.
I will prescribe medications, prescribe procedures, prescribe CAT scans, MRIs, only to find out that I have to argue with someone in order to get them covered, or that the patient just can't afford coverage to it. So we're not getting it done. So I think it would actually reduce my burden and the amount of time that I
Because of everybody's going to the doctor because they don't need the insurance, they just can go. And that would help out with like the minimum wage employees. If their employers would pitch in more, then maybe they could afford the rest of it.
I think that society would benefit from providing a basic level of health care to everybody.
Providing health care to 22 million Americans who didn't have it is a good thing.
People should have to pay for healthcare based on their income.
That way, people with lower income can get the healthcare they need, and people with higher income have less of an advantage.
More people can get more of the coverage that they need.
Now we look to the presidential candidates to determine where we go with healthcare costs for our future.
Mr. Hoyer, gentleman from Maryland is recognized for 3 minutes.
The ranking member took the words right out of my mouth that weren't covered. Mr. Speaker, the Wall Street Journal reported on Monday, and I quote, House Speaker Paul Ryan, starting this month, will push to turn the chamber into a platform for ambitious Republican policy ideas. My friend, Mr. Upton, talked about